Hey guys, so I've been trying to make this video for like an hour. It's about take 20. I'm trying to do a video on what it's like to be an adult with ADHD. Except I keep like rambling and getting distracted and getting way off topic. The irony there is not lost on me, but now the problem is I forget what I have and have not talked about. So I'm trying to have to do this with a minimal editing post-production. I just wanted to talk about this because I actually had told someone a year ago, maybe more than a year ago, that yes, I was going to submit to their zine about what it's like to be an adult with ADHD and, how that affects you at work or with people that you meet as an adult and try to become friends with or such. So, I'm going to do a quick disclaimer here and say I am not a doctor. I don't actually even have a diagnosis as an adult with ADHD. I just have a diagnosis as a kid. So, if you don't know this, I would do a quick like image Google search for brains of people with ADHD versus normal brains, and you'll see like the chemistry makeup is really different. And even though the chemistry in your brain does change slightly as you go through, like being a kid and an adolescent and you hit puberty, it doesn't like completely change or reverse itself. So logically to me, if you had ADD, ADHD, or any type of disorder as a kid, you are probably still going to have that same disorder as an adult and your entire life. They don't just go away. So I'm going to talk about this video. I'm going to give you a quick background of being a kid with ADHD, but mostly I do want to address the adult side of it. So I'll try to not ramble and make this super long as much as possible. I'm going to say a couple things about, just from my observations, comes from, I've read books, or at least parts of books, by doctors or psychiatrists or psychologists that specialize in ADD, ADHD, and I actually did so to try and understand myself a little better, and it really was kind of blew my mind to figure out that other people's brains do not work like my brain does. And it probably shouldn't have, but it did. And then so it's based on my reading, just my observations on personal experience. So again, I'm not a doctor, just kind of some insight from somebody who has grown up and lived with this. The thing about being ADD, ADHD is there's perceptions and they've changed. When I was a little kid, I don't even know if people really use those terms, ADD, ADHD. You were just like the kid that misbehaved and disrupted class, and so you were on Ritalin, and your teachers mostly were just trying to like get you to pass their grade so you didn't come back next year. Um, Today, especially if you're like an educator or a parent, but society as a whole is a little bit more understanding, I think, to kids that have ADD, ADHD, or learning disabilities like dyslexia. My uncle was a kid, people didn't know what that was. They just thought, hey, you're stupid. They didn't realize that, hey, you just can't see these words because of the way your brain is working, and you're actually like super smart a lot of times. So already I'm getting off topic, I know. So I'm bringing this up for a couple reasons. Mostly I want to talk about the underdiagnosis of girls. And I've read a little bit about this, and again, it's just kind of more observational on my part. But girls really are underdiagnosed, particularly when they have the hyperactivity component to this. And I could really speak for hours about it, but I won't. We really tend to socialize our kids based on their gender, and I really am opposed to it, but it happens. It just does, for lots of reasons. If your boy runs around and he's having a sword fight in your living room, you will probably eventually scold him, but you won't. You'll that behavior is somewhat acceptable and expected because he's a boy and you expect your boy to be a little wild. If your little girl does that, or if your little girl is aggressive or assertive too much more often we scold the little girl, we tell them they need to act like a little lady. Girls don't do that. Which really makes no sense to me at all because even the most like normal passive kids I've ever met are still entirely like full balls of energy from the moment they wake up until the moment you like force them to go to sleep. They're on all the time. So just saying that hey my kid runs around a lot does not necessarily mean that your kid is ADHD. Doesn't mean they're not. But I think often we jump to that because we don't want to let kids just be kids how they should. So, I was, as a little girl, oh, I wanted to say this too, if you are the parent of a girl who is just kind of really aggressive with you or acts out in an unusual manner that's not just, kids misbehaving or being mischievous like kids are, um, I would Google some, ADHD symptoms, particularly of girls, take a look, see if, hey, maybe this matches up with what your little girl has. Because as I said, it does tend to be misdiagnosed or underdiagnosed in girls too often still. And that, it's really going to affect them their entire, how much they can achieve through their school career and possibly even their career beyond. Anyways, so when I was a little kid, I don't know, like I said, if we even used ADD, ADHD terms very much, you just were hyperactive. And as a girl, I acted out so much that my mom consulted with my doctor who diagnosed me as hyperactive enough to prescribe Ritalin. My mom didn't really believe in putting kids on medication unless she felt they truly, really needed it. Her thing was that she thought most kids, if you really actively parented them and set really clear boundaries and expectations, and were an authority figure to them as a parent, they could probably get along okay. Whether you agree with that or not, that's okay. That's just the background that I grew up with, is why I wanted to address it. So I didn't have Ritalin as a kid. I didn't have any type of medication, and my mom never really even told me about this until I was older. So I did not go through school thinking that I was a hyperactive or ADD, ADHD kid. I just went through school and did pretty well in school, actually. Struggled to pay attention sometimes, and I just thought that was normal, and I would just get bored because I just thought that was normal. I can actually remember I'm an avid reader, and so I might be in a math class trying to learn algebra stuff, and if I got too distracted, I would while I was trying to learn algebra, also be kind of telling stories about characters in my books to myself to help my brain focus. I needed to engage separate parts of my brain to make one part of it focus. And it wasn't until I started reading about how this was unusual that I realized that most people probably not only don't do that, but they would have a difficult time trying to do those two things at once. So, if I'm saying, if you're the parent of a kid who has ADD, ADHD, that is probably really how their brain is working. They really need lots of different things to engage them at once to actually make them focus. I'm probably moving around a lot in this video. I'm trying not to, but it's really hard for me to really truly sit still. I usually have to tap my foot or do something. I kind of can be a little twitchy sometimes. I know, it's just the hyperactivity coming out. Anyways, so that's kind of how I grew up with it. I went through school, like I said. I actually did really well in school. I would do homework for other classes while I was in class. And luckily, oftentimes kids on the spectrum of autism, Asperger's, ADHD are usually fairly smart. Not always, that can be a misconception, but so that kind of worked to my advantage. And because my mom didn't treat me differently and didn't expect my teachers to treat me differently, I just sort of went with it. And part of that, I don't think I addressed this in this 20th version of the video. I think she was really true to this, is that often if you were labeled as the problem kid, once you got whatever label in kindergarten, first grade, unless you moved to a new school, that was your label as a kid, and every teacher knew it, and that's how you were treated. And one of her other things about not putting kids on medication was, as soon as I became the girl on Ritalin, I would have been the kid that needs Ritalin, and the teachers would have just been like, she's going to be a problem, and treated me that way before they even had me in class. So that was another reasoning for her, and I think she was probably accurate, especially then, maybe less so now, although it's going to depend if you have an old school teacher or not too. Anyways, back to the topic, Carrie. We were talking about going through school, either choosing to be on or off medication. I do sometimes wonder if I would have had medication, how much more I could have excelled at school. I did pretty well. I got pretty good grades, a little less so in college, but I mean, I still had well over a 3-point average. I didn't do poorly in college, and that was, with ADHD, without medication, occasionally, sometimes maybe being a little bit of a slacker even. So it can be done. Whether or not you choose to put your kid on medication, it's a personal decision. I don't judge anybody for choosing to do so or not do so. You and your kid have to kind of decide that. Does it help them? Is it better for them or not? And when they're little, unfortunately, you have to decide that, and then as they get older, start discussing how it makes them feel, how much it helps them. Is it, whatever. I'm getting off topic again. So, moving on to the medication. So as an adult, like I said, I have actively chosen not to go get an adult ADHD diagnosis. And it wasn't really until my friends and colleagues started to have kids that were getting into school systems and starting to have problems, and this started to come up with a couple of them that, hey, your kid is on the spectrum for ADD, ADHD, or Asperger's even in some cases. And so I started learning about the symptoms from the perspective of a parent learning about them from the first time. And I started to say, hey, this actually sounds really familiar to me because this is exactly how my brain tends to work. It was kind of a weird experience, to be completely honest, because I started to see certain like behaviors and patterns and understand a little bit their kids on some level that, oh, they're doing this because they need to have the TV on while they're running around because they need that extra auditory sensory or whatever, which, some of those parents, it drives them nuts because they're like, why is there all this noise in the house? So that's kind of when I really started to look at it. So shortly after that, within a year or two, some things at my job changed a little bit. I still had the same job, but just some of the like roles and responsibilities changed, which happens. But some of them I was really struggling with, more so than other people, and I actually kind of like change, so it wasn't just a, hey, my job is changing, I'm gonna just resist it because I don't want change. It was like I was genuinely struggling to accomplish certain things, and I couldn't figure out why at first. Then I started, this sort of all aligned at the same time, and I realized that a lot of it had to do with the way ADHD affects how I work and learn. Coincidentally enough, one of our HR people at work has a son who is ADHD, which has influenced my decision about talking about it with her. Um, when you're an adult with ADHD, you have some decisions to make. Do I go get an official diagnosis? If I do I choose to disclose that at work? Well, if I disclose it at work, is my work going to expect me to medicate myself to do my job? Do they have a right to ask that of me? It's kind of a lot of stuff around it, and I've chosen not to get the diagnosis because I do not want to medicate. I've actually been kind of curious, like, if I could just, get some Adderall to try for a week to see what changed at work, I would probably do it, but I'm not willing to go through all the steps to do that, because, I grew up with my brain functioning like my brain functions, and I actually kind of like that, and I'm pretty comfortable with it. I do well at work. Like I said, I was struggling with certain things. But because our HR person is the person I would go to with this, she has an understanding as a parent of someone with a kid. I'm pretty sure she medicates her kid. And I definitely felt like if I bring this to them, they're going to expect me to have a something from a doctor that says, yes, this is a legitimate condition, and, you need to accommodate these working conditions. But I also felt like I would get some pushback about, well, what are you doing about it? Are you taking this medication? Because, hey, this medication helps my kid. And again, like I said earlier, medicating is really a personal choice, and it's really hard, and there's not a right or wrong answer. I really don't think there is. I think different people are going to react differently to it. It's going to change how your brain functions a little bit. And for some people, that's, like, for me, obviously, clearly it's tied to my identity. I like how my brain works. I'm used to how my brain works. I kind of have just worked through my issues with ADHD. Clearly enough that I'm not willing to make those changes at work, so I've chosen not to disclose that. By not disclosing that, though, it means that I have the same expectations as everyone else, and I have some like genuine struggles to get some stuff done. It's changed a little bit again, and I've kind of worked through getting some stuff done, but I still have the issues with deadlines are really classic ADHD problems. Although my issues with deadlines are if you give me a deadline, that's the deadline, and so if somebody gives me a deadline and then like my boss gives me a deadline that's a week earlier because his boss gave him a deadline that's 2 weeks earlier, that really annoys me. Just as an aside, like that happens all the time in the workplace. Like, if you want the deadline to be in 1 week, just make it in 1 week. Don't make it in 4 weeks and then have everybody give you other fake deadlines. So, again, off topic. But that's really been a big thing for me was trying to decide, hey, do I want to go get like this official diagnosis? Because I'm pretty sure it won't fly with an HR person if I'm just like, hey, when I was 4 or 5, my doctor said I was hyperactive and tried to give me Ritalin, and I said no. My mom said no, and now I need special accommodations at work, but I'm still not going to go to the doctor and get medication to a person that's even having someone who is familiar with this condition in that position, I know that's not going to fly. I've read from people who, as adults, choose to take Adderall is the probably the most commonly prescribed ADD ADHD medication right now, but there's some other ones out there all the time. And they say it makes a huge difference at their work. And so part of me thinks maybe I should give it a shot. Maybe it would really motivate me more. Maybe I would get all this other stuff done. Okay, this would be the awkward video cut where my computer shut down recording because I didn't realize it was not plugged in. So, wrapping up discussing being an adult at work with ADHD, and if you decide to disclose that you have ADD, ADHD, if that requires any information from your doctor, how much you have to discuss medication or special accommodations or anything like that with either your boss or your HR person. And those are all legitimate things because whatever you decide, it's going to affect people's perceptions of you. If you're always struggling with deadlines, people are just going to think that you're bad at deadlines, or maybe they're going to look at your job performance, and then you weigh that against, well, if I explain to them that I have this condition, are they going to understand it? Maybe, maybe not. Have they ever been introduced to it before? Do they think you're just making excuses? So you kind of are choosing, I think it's one of those choose your battle things. Which would you rather have to deal with? Maybe struggling with a few things at work and having to have that perception, or maybe being able to perform your job more like a normal person's would perform it, but then also having that other, I don't want to say pushback, but that other perception where maybe your supervisors now question your abilities because of this. It's really kind of, it falls into that there's not a right answer, you just have to decide for yourself, but it's definitely something that people with ADHD have to think about. I have a job where I'm fairly active during the day, like I'm interacting with lots of people and stuff, which I think really helps me. I've had an employee tell me once that if I ever had a cubicle job, I wouldn't be able to handle it because I can't just sit and be quiet and still for like 5 minutes, much less an 8-hour day. He was probably really accurate. So, the type of job you go into, depending on what is involved in that, you might be really good at, or you might be really good at it regardless, but your ADHD might be more of a benefit or more of a hindrance to it. The only other thing I really wanted to address was kind of like your interpersonal relationships being ADD, ADHD. Most of the friends that I hang out with are people that I've known for a while, from college and stuff, so they're kind of like, oh, that's my personality. One of them in particular has one of these kids I've mentioned, so she gets it a little bit more than others. Sometimes when you meet new people, it might be a little awkward. Like, I probably come across a little obnoxious sometimes. Like I said, I'm hyperactive, I'm also an extrovert. It's probably go hand in hand. But, I meet some really cool people. I know that some of these kids I've mentioned have had hard times making friends because the other kids think they're weird. And these kids, they're kind of weird, but they're cool kids. I like these kids. And I don't remember when I was, like in young elementary school, having a difficult time making friends. I had some friends, but I also recognize that kids don't always really know what the heck is going on around them a whole lot, so I might have had like one friend and everybody else thought I was weird, and I really just don't know that, and that's okay. But that is a struggle if you have kids that are like having a hard time making friends because of their ADD, ADHD. That is actually apparently kind of common. So I forget what I was going to talk about because the whole computer shutting down kind of distracted me a lot. So I'm going to wrap it up here, although if you have any like questions or like responses or specific things that you want to know about like being an adult with ADHD or whatever, feel free to leave me a video or a comment and I will try to respond to all of them. Hopefully somebody found this useful and informing. We'll see if I can get my article written, and that's it today. Thanks.